Hello students, today I am here again with the continuation video of chapter 7, that is Physiology and Injuries in Sports. So in the earlier video students, in the part 1, the video that is part 1 of the chapter 7, that is Physiology and Injuries in Sports, we have covered first of all the first part, that is Physiology. We have discussed all the physiological factors that determining the various components of physical fitness, as well as what are the effects of exercises over various systems. So today we are going to discuss the second part of the chapter, that is injuries in sports. So students, we are going to discuss about sports injuries, its classifications, causes, and what are the probable preventions we are going to discuss elaborately. So, first and foremost, we need to understand what is sports injury. Students, injuries are part and parcel. Injuries in games and sports are very common. It can occur during training session. It can occur during competition period also. So, injuries are very common in play field. Next, we are going to discuss about the types of injuries. Basically, these are the common types, that is acute injuries. Now, what are acute injuries? They occur when there is a sudden stress like collision, being struck by an object, falling from a height. You can see in the image also, students, when you are not ready for it, suddenly a ball hits you, then you are being struck, collision occurs, you are falling down from a height. So they all are included under acute type of injuries. Next is chronic injuries. Chronic injuries are caused by continuous stress on a body part over a longer period of time. They can be caused by training too hard for longer duration of time. Overuse injuries occur due to repeated powerful muscle movements. So these all consist of chronic injuries. Another type of sports injuries can be hard and soft injuries. Hard injuries means, students, basically the bone injuries, where various types of fractures occur. As you can see in the image, students, hard tissue injury are bone injuries. Means basically various types of fractures we will be discussing under hard injury. Next is soft tissue injury. In the right hand side, the image you can see that soft tissue injuries involve damage to our skin, muscles, tendons, ligaments, and cartilages. Now, soft tissue injury. Let us have an overview of soft tissue injury. There can be open injury as well as closed injury. Now, what are open injury? An open injury means that the skin has been broken. Blood usually escapes, means on the topmost layer of our skin, that is superficial layer of our skin, blood is not visible. Okay? Next, closed injury. A closed injury occurs beneath the skin. That is, there is no external bleeding. So, open injury and closed injury. Open injury, it can be visible from the outside. You can assume, you can predict that yes, this is an open injury. Bleeding you will be seeing on the superficial layer, on the topmost layer of the skin. Whereas in closed injury, you will not see any sort of bleeding. You will only observe change in color, swelling will occur. Now, here I am with some of the example students. As you can see, open injury, see the image. Now, there is a cut on the eyebrow. On the other hand side, abrasion sort of disease. You see, abrasion is a soft tissue injury where the part of the body is get rubbed against a rough surface. So these are all visible from the outset, from our open eyes, where we can see bleeding occurring on the superficial layer of the skin. Moving ahead. Another example, you can see blisters are caused by the skin rubbing over other surface. Sometimes any hot particles, hot fluid falling on our body part, blisters are occurring. Now, in the other hand again, the right hand side image you can see that from the outside bleeding, the rashes you can see. So, where we see bleeding, these are all open injuries. Now, closed injuries. You see this example where our ankle got twisted. So from the outside, we cannot see the injury, but injury has taken place. Now, sprains occur when ligament at joint gets stretched and torn. So this is sprain sort of injury. Sprain is also a type of soft tissue injury only, which we will be discussing later on. Now, on the right hand side you can see the muscle has been strained, the cuff muscle student. You see the athlete is holding his cuff muscle. Means the cuff muscle has been strained, has been stretched. There is a muscle pull. So muscle pull, they are not being seen from outside, from our eyes. But injury is taking place inside the muscles. That is why they are called as closed injuries. There is no bleeding occurring on the superficial layer of the skin or the topmost layer of our skin. They are all called closed injuries. Another example, you see dislocation occurs at the shoulder joint. Next, the ankle got twisted. So these are all examples of closed injury where bleeding is not occurring from or on the outside layer of our skin. We also call it superficial layer of skin. Next you see, this is contusion. The change of color occurs, but bleeding is not there. Same, just below the eyes, you see swelling. He might have got hurt, get hit with any hard object. That is why swelling occurs, blood clots inside, but on the topmost layer of the skin there is no bleeding. Now according to your syllabus students, in your syllabus these three classifications are being given. That is soft tissue injuries, bone injuries and joint injuries. So here we are going to discuss these three types of injuries elaborately. See, these five are the soft tissue injuries. They are contusion, sprain, abrasion and bruises. So let us discuss these soft tissue injuries one by one. The first one is contusion. Contusion is a type of soft tissue injury where basically the individual got hit by a hard object. For example, student, let us assume this marker pen as a iron rod or any hard substance, a stick. Okay, let us take an example as wooden stick. So if I get hit over my forearm or any part of the body with the stick, what happens? In your childhood stage, many a times you must or you might get hit by a stick. Is there bleeding occurs on the topmost layer of your skin? I am very sure, students, your answer will be no. Whereas the change in color occurs at that place. It can be reddish, it can be bluish, as well as swelling occurs. So that is contusion. It is a type of injury where bleeding does not occur on the topmost layer of our skin, but the part of the skin changes its color. Sometimes swelling also occurs in that place, and it may create hindrance, it may create problem in movement. So these are common in boxing, wrestling and kabaddi sort of games and sports. Moving ahead to another type of soft tissue injuries, that is strain. Now basically these are muscle injuries. Strain are the muscle injuries. Now in games and sports, we find sports persons are getting hamstring injury. Hamstring means the back side of our thigh. Hamstring injury is very common in the games and sports arena. If sports persons are not doing proper warming up, then they are most probably to get hamstring injury. So strain are the muscle injuries. When putting more pressure, excessive pressure on muscle groups, it can be get stretched, which may lead to muscle pull. Next is sprain. Sprain are the injury to our ligaments. It may occur due to overstretching or tearing of ligament. Now what is ligament? Ligament are the white fibrous band. It is very much similar to white thread which holds the joints firmly, which holds two or more bones in a joint properly. So sprain is an injury to ligaments. Swelling, inflammation, severe pain. So these are common symptoms of sprain sort of soft tissue injuries. Next one is abrasion. Another name of abrasion is superficial injury, because in abrasion the topmost layer of our skin, which is also called superficial layer, gets rubbed against a rough surface. This is very common injury in contact games and sports students. For example, football. Take an example in football. While sliding tackle, a footballer is going for sliding tackle. In the process, his superficial layer of the leg muscles, thigh muscles get rubbed against grassy surface, and sometimes abrasion sort of injury occurs. In simple, the topmost layer of the skin gets rough. Moving ahead, next is bruises. It is an injury appearing as an area of discolored skin. Red, blue, dark purple sort of color appears on the body. Now it is caused by a blow or impact rupturing underlying blood vessels. It is very much similar to contusion sort of soft tissue injuries. So these are the following soft tissue injuries that we have discussed right now, students. We have discussed contusion, we have discussed strain, we have discussed sprain, we have discussed abrasion, and we have also discussed bruises. So these are the 5 types of soft tissue injuries. Next, how to manage? How to manage soft tissue injuries? The best method, student, is RICE management. RICE, RICE. You can also add the word P also, students. It will become price. PRICE, price. Where P stands for protection, R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. So this technique must be used, students, for proper management. Proper rest should be taken by the affected athlete. Ice therapy. Up to 48 hours of injury, ice should be applied over the injury part. Next is compression. You can tie the crepe bandage firmly, tightly, so that it should not move here and there. Next is elevation. Elevation means to elevate the injured part. So this is the RICE management, students. Through this, all the 5 types of soft tissue injuries can be cured. Moving ahead. Next is bone injury. We have discussed hard injury, soft tissue injury. So bone injury are coming under hard injury. Basically, bone injuries means fracture. So here we are going to discuss various types of fracture, students. We are going to discuss simple fracture, compound fracture, complicated fracture, green stick fracture, comminuted fracture, impacted fracture, as well as depressed fracture. So the first one is simple fracture, where the bone is breaking into 2 pieces and it is not creating any harm to its surrounding tissues or any muscles or ligaments or cartilages. Second one is compound fracture. Now this fracture, along with this fracture, what happens? Skin, muscles are also damaged. Generally, the broken bones come outside, tearing the skin. So compound fracture is a type of fracture where the broken end of our bones comes out in contact with the open air by tearing the skin. It creates a lot of damage to its surrounding tissues, and also the broken end of the bone might get infected because it comes in contact with the open air. The third type of fracture is complicated fracture. Now this fracture occurs with internal organs like tissues. It creates problem to tissues. Nerves or arteries are getting damaged by complicated fracture. Such fractures are dangerous and common in high jump and pole vault, because in high jump and pole vault the individual, the athlete, is falling down from a reasonable height, so it is very common. The fourth one is green streak fracture. Basically, this green streak fracture occurs in small children, the kids. In their bones, they does not have clear breakage. Rather than breaking it clearly, it is being curved, it is being bent. You take example, student, if you see the good quality plastic and you try to break it, instead of breaking, what happens? It gets bent and there is a whitish line coming in between from where the bend is taking place. So it is very similar. Green streak fractures are occurring in children. So let us go to the next type of fracture, that is comminuted fracture. Now what are comminuted fracture? The bone is broken into two or more pieces. It is common in cycle and motorcycle. So if somebody falls down from a motorcycle or sometimes cycle, so the bone is breaking into two or more pieces. It is comminuted fracture. Then the next one is impacted fracture. The fractured bone enters into another bone. Impacted fracture is a type of fracture where the broken end of the bone is penetrating, is getting inside another bone. How much danger it is. The last one is depressed fracture. Bones are broken and go down below their normal level, usually found in the skull. So depressed fracture are bones are broken and go down below their normal level. It is found in skull. Next, management of fracture. As you can see, students, support is being given. Why the support is being given? This is sort of first aid only. Support is being given in case of fractures because there should not be further movement. If movement will be there, the injury may deteriorate. That is why, to restrict further movement, support is being given. Then after reaching to hospital or nearest doctor, they are the best medical expert who can handle the intense cases. So moving ahead, students, next is joint injury. As you can see, dislocation and arthritis are coming under joint injuries. So dislocation of lower jaw, dislocation of shoulder joint, dislocation of hip joint. So these are dislocations, three types of dislocation, student. There is another, okay? Another one is arthritis. Arthritis is a sort of joint injury which generally occurs with the old citizens, the old persons. Basically in arthritis what happens, they experience lot of pain in the joints. Now there is a fluid present in our joints. That fluid starts drying up as our age progresses. As we grow older, that fluid starts drying up. So when the fluid dries up, what happens? The bones in the joint get rubbed while movement is taking place, and it creates pain in our joint, which is called arthritis. So now let us discuss the three types of dislocations. The first one is dislocation of lower jaw. We have upper jaw and lower jaw. So dislocation of lower jaw, it occurs when chin strikes to another object. It is very common, students. Dislocation of shoulder joint, this shoulder girdle. So it occurs due to sudden jerk or a fall on a hard surface, as you can see on the image also. The third one is dislocation of hip joint. It occurs by putting maximum strength spontaneously. End of femur is displaced from the socket. So these are the three types of dislocations, that is dislocation of lower jaw, dislocation of shoulder joint, as well as dislocation of hip joint. Now, the management of injuries, the management of dislocations are: immobilize the affected limb by bandage. Means bandage should be rubbed so that there should not be any further movement. Don't try to adjust the dislocated limb of yourself. We should not try to relocate the impacted part of the body. Athlete should be taken to hospital on a stretcher so that movement can be restricted. Now, next slide, students, as you can see, injury diagnosis. How an injury can be diagnosed in games and sports. So first of all, we need to talk what these physios they are doing. All the advanced sports teams, they are having physios. A medical team, medical experts are there. They are first of all talking with the sports person and try to understand the things. Then they observe the movement. Then they touch the affected area. Next is active movement and passive movements are taking place or not. Last one is skill test is being done. After that, the result is being announced that whether he is fit for the match or not. Now this is a complete exercise program, students. Although this is not in your syllabus, but for your knowledge information I have tried. At first, warming up phase need to be carried on. Warming up means slow walking, calisthenic exercises, slow jog. Next is stretching exercises from top to bottom need to be done for 20 to 60 minutes. Warming up need to be done for 5 to 10 minutes. Next, active exercises like cycling, running, dancing. It should be done for 5 to 10 minutes. Next, warm down means it is also known as cooling down exercise, limbering down exercises like slow walk, calisthenics, jog in a place. It should be also carried on for 5 to 10 minutes. Next is stretching, means slow stretching. Down to up means reverse For warming up, in warming up, whatever stretching we are doing, it is top to bottom. But from limbering down, we are doing the stretching from down to top, reverse. It is also for 5 to 10 minutes. So, next we are going to discuss about management of injuries, how to manage. So, these are the probable preventions. The individual need to undergo proper warming up. We all are well aware, students, warming up helps in increasing the body temperature. Warming up makes our body ready for the competition period, and also it minimizes the chances of injury. Next is proper conditioning. Conditioning exercises means when we are going for the development of physical fitness components like strength, endurance, speed, flexibility, coordinative abilities. So when we are going to develop these components, certain set of exercises need to be undergone, need to be practiced, and they are known as conditioning exercises. So proper conditioning exercises need to be undergone, need to be practiced. Next is balanced diet. Yes, simply exercising, simply putting effort is not enough. On the contrary, the sports persons, athletes need balanced diet which maintains balance. Now, whom do we call balanced diet? The diet which contains all the necessary elements of diet in proper proportion is known as balanced diet. Next, proper knowledge of sports skills is very, very necessary, students, to get prevented from getting injury. For example, I give you, in football there is a rule that no footballer can raise his leg beyond shoulder height of opponent. So this is a rule. Now if somebody is not aware of the rule, what he or she will do? Unknowingly, they might raise his or her feet in kicking the ball. So this is purely immaturity. This is purely lack of knowledge about sports skills. So the sports persons need to enrich themselves in having proper knowledge about sports skills. And here the sports coaches, the trainers, they must play a vital role in imparting the knowledge, sharing the information with his fellow sports persons. The fifth one is use of protective equipments. Yes, it is very, very important, students. Protective equipments have to be used during practice session, during competition period. An individual sports person cannot neglect protective equipments. They must use, because they protect. Their job is to protect. Next is proper sports facilities. Yes, proper sports facilities reduces the chances of injury. As in the image you can see, student, this is a pic of synthetic track. So if proper facilities are not available, what will happen? Assume of a playfield which have small dips, which have pebbles. So this may lead to sports injuries. That is why proper facilities are very, very important. Next is unbiased officiating. Unbiased officiating means showing off discrimination by the officials. Officials are not doing their job properly. That is unbiased officiating have to be mandatory. There should not be any biasness. For officials, both the team members, all the sports persons have to be equal. Then only the game can be played with the good spirit, with sportsmanship also. And injuries can also be reduced, protected. Next is, do not overtrain. That means an athlete, a sports person should not train when he or she is getting tired. He or she should stop his or her training then and there. If you overuse any muscle groups, any part of the body, you are tend to get injury. Next is use of proper technique. Yes, techniques. Use of proper technique is very, very important, students. That is known as scientific training. Scientific training consists of use of proper techniques. Unknowingly, sometimes, if any sports person, any athlete uses wrong technique, it may also lead to injuries. Next is obeying rules and regulations. It is very, very important. If every sports person obeys rules and regulations, chances of injury will be very, very less. Next one is proper cooling down. It is as important as warming up, students. But most of us are not following the principles of cooling down exercises. As warming up helps to increase the body temperature, cooling down helps to reduce or neutralize the body temperature. Most of us, after playing, what we do? We immediately move back to our home and take shower because we are already full of sweat. But that is very, very harmful for our muscles. Cooling down exercises helps in reducing the temperature of our muscles and also lowering the lactic acid concentration from our muscles, which will help the sports person to train in the following days. If lactic acid concentration remains in our muscles, it will lead problem. It will make the sports person feel problem in going for training the very next day. Next we are going to the final stage of this chapter, students, that is first aid. Now, what is first aid? First aid is the initial assistance or the treatment given to a casualty for any injury. First aid is the first treatment given to an individual before medical expert arrives or before medical assistance is being provided. Now, the management of injuries, students. This is with the help of first aid. First aid also helps in managing injuries. Like basic knowledge of first aid is very, very essential. Immediate first aid is required. In absence of first aid, consequence may be serious for sports persons. Because everywhere, every time, medical experts are not present. Keeping that in mind, the duty of first aider is very, very important because they are the individuals who give first assistance to the affected sports persons. Now here we are going to discuss the aims and objectives. The aims and objectives of first aid. They are to preserve life, to prevent deterioration, and to promote recovery. These three are the basic, important aims and objectives of first aid. That is, first of all, to preserve, to save the life of sports person. Second is to prevent deterioration. It is the duty of the first aider to try to not to deteriorate the condition of the sports person or the athlete, and promote recovery. Recovery should be promoted. As soon as possible, the injured sports person should be reached to the nearest hospital, or medical assistance should be provided to the injured sports person. So these three, that is, preserve life, prevent deterioration of the injury, and promote recovery. Whatever first aid they should give, it should have the objective of giving recovery to the injured sports person. Students, in 1996 Olympic Games, there was a sports person known as Juan Antonio. You can see his quote. He has quoted that sports is a friendship. Sports is health. Sports is education. Sports is life. Sports bring the world together. So with this, students, I come to the end of this chapter. That is chapter 7, Physiology and Injuries in Sports. So today we have covered the second part of the chapter, that is injuries and types of injuries. We discussed hard injury, soft injury, we discussed soft tissue injuries, we discussed the bone injuries, we discussed joint injuries, then we discussed about the various preventive measures, how we can prevent sports injuries elaborately. At last, we discussed about first aid and its aims and objectives, students. I hope this video is going to help you a lot in having a better understanding. If you still have any doubt, you can approach me personally. I will be very happy to help you, students. So take care of yourself, take care of your health, study regularly and refer these videos. These videos are going to clear your doubts, are going to develop your concepts, students. So thank you all of you.